welcome to Medical Dialogues, your daily dose of health and medical news. I am Dr. Nandita Mohan and let's look into today's reports. Intake of sesame seeds and sesame products tied to lower blood sugar. Sesame, as we all know it as til, is traditionally a plant-based material most commonly used in the Asian regions. Sesame seeds and its products, including oil, flour, and dietary supplements, are good sources of nutrition for the human body. Now, the medicinal actions of sesame, including its anti-inflammatory actions, antioxidant activity, and hypoglycemic effects, as per a recent study published in the Phytotherapy Research Journal, the consumption of sesame seeds and its products have a favorable effect on blood sugar levels, but not on insulin resistance, and sesame may be a beneficial agent for human glucose metabolism and can be a part of even glucose-lowering diets. The research showed significant positive effects of sesame and its products on fasting blood sugar. Revascularization with CABG tied to lower MI risk than PCI in left main coronary artery disease. Cardiac diseases and its management are very crucial, and the choice of a better treatment is even more challenging. Now, the debate between the coronary artery bypass grafting as well as the percutaneous coronary intervention, that is the angioplasty procedure with drug-eluting stents, have been going on for decades now. Though there are first-line revascularization strategies for the left main coronary disease, however, there is no clarity on whether one method is more effective than the other in patients with low or even intermediate coronary anatomical complexity. But results from a recent meta-analysis in The Lancet revealed no significant difference in a 5-year all-cause death between patients treated with a PCI therapy versus the CABG for left main coronary artery disease. However, a probable minor difference favoring the coronary artery bypass grafting, that is CABG, was also defined. The repeat revascularization and myocardial infarction rates were seen to be more significantly common in patients who had undergone the angioplasty, that is the PCI procedure. Marijuana use in patients with orthopedic trauma. Cannabis, also known as the marijuana among other names, is a psychoactive drug from the cannabis plant, which is generally an extract. Native to Central and South Asia, cannabis use is a subject of much interest as it being used most commonly on both recreational and medicinal basis. With increased legalization across the states and thus lessened legal ramifications, marijuana use will be seen frequently, with patients more likely to endorse it as a treatment. A recent review has enumerated several effects of marijuana in case of orthopedic trauma. The question for the orthopedic surgeon is how to counsel such patients and other physicians regarding injury and also coinciding with marijuana use. Patients who have sustained orthopedic trauma are unique in that rehabilitation is multimodal and variables other than fracture healing must be taken into account. Traumatic brain injury and post-traumatic stress disorder following major trauma can be debilitating and have a high prevalence. While human studies on the effects of marijuana use on traumatic brain injury and post-traumatic stress disorder are lacking, some have shown significant improvement in symptoms. Stroke rates greater in younger women than men. Stroke is one of the leading causes of death globally. About 1 of every 18 deaths. On an average, someone dies of a stroke every 4 minutes. However, a recent research on the young adult age group reported there are more young women between the ages 18 to 45 with ischemic strokes compared with young men, suggesting that women in that particular age group may be disproportionately at higher risk compared with their male counterparts. The study also reported on sex-specific stroke incidence among young adults and found that overall in young adults aged in that particular group, that is 18 to 35 years, there was a 44% more women with ischemic strokes than men. For a better understanding, these sex differences, however, are important in implementing strategies that can more effectively prevent as well as treat stroke in this particular age group. That's all for today. Stay safe.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.